Okay, Instagram Live, YouTube Live. Good afternoon, everybody. Welcome back. I'm back, baby. I wanted to make sure I didn't miss you guys too much, so we're doing a remote feed Q&A, answering all your questions. Sorry that we're a little bit late. It just took a little. I'm not the most technically savvy person, so I needed some help to get everything up and running here. But we are going to do one of our famous Q&As. Shoot me any questions you want. I'm going to do everything I can to answer all your questions and make you comfortable with where you are with your workers' comp case. And we're back, baby. We're going to throw up some slides, and we'll get to those first. And as always, if you have questions, throw them at me, and we will get to you. Okay. My name is a little funky down there in the corner, just says Rex, but you guys know who I am. I maybe will fix that later. So, Ms. B, I'll answer your question too, but it's a yes. If I settle for a lump sum, what percentage of the total case value can I expect to get? So this is a question we get all the time. Very common question, because as you're reaching the end stages of your cases, whether it's a schedule loss case or a permanent partial disability, a PPD, those non-scheduled cases, you kind of get a better understanding of what your case value looks like. So if you're found to have a 50% permanent partial disability and you were earning $600 a week, well, now you know you're going to get $300 a week for 300 weeks. And when you add that all up, $90,000, well, you know they're not going to give you $90,000. They're not going to give you the full value if you settle your case. They're going to give you a percentage of that. So people like to know, what percentage of that total case value should I expect to receive if I'm going to settle my case? And it's hard to really pinpoint it. You know, I've seen insurance companies offer as little as 30% or 25%. I've demanded as high as 90% of it, sometimes even more. But it really depends on the specifics of the case. Where do you land? Usually in the 50, 60% range, but every case is different. And we're going to be a little morbid here, but I hate to do it. Life expectancy is a consideration from the insurance company. There's other factors that they consider as well. Sometimes if you're young, super young, they think, hey, you're not going to sit home and do nothing for the full 300, 400, 450 weeks. That is the term of your permanent partial disability. This person's 26 years old. They're not going to do that. They're going to go back to work in a couple of years, and you know they kind of bank on that. So every case is a little different, and you have to look at the specifics of each case to figure out where in that range of percentage of the overall value you're going to get. But they're not going to give you the full value. If I told you that you owed me $1,000, would you rather give me would you give me $1,000 up front, or would you rather give me $10 a week for 100 weeks? Obviously, you'd like to give me $10 a week for 100 weeks, because at the end of the line there, that $10 is worth way less, and it's no big deal. It's really not a big deal now, but whatever. You understand what I'm getting at here. So usually you're in that 50, 60% range, could be 70%. Could be 80%. The medical also plays a role. How you're going to settle, if you're going to do a full and final settlement, an indemnity-only settlement. There's a lot of different factors to consider here. So the view on the Instagram is really, you're looking a lot up. I'm sorry. My phone is perched precariously on my laptop here, so doing the best I can. But yeah, a lot of factors to consider. Every case is different, as we know. But those are questions you should also have with your lawyer, and that's why it's important to have a lawyer, important to have a good lawyer who understands those ramifications and those factors and what to look for. If anybody here needs a lawyer, as always, I'm happy to help. 212-406-8989. That's how you find me. I know Miss B wants to get to the big question at hand here. Where to go? Where to go? So yes, we thought we got the call last time. We didn't get the call. The call came a few days later, but we're good. Mama's good. Baby's good. Everybody's happy and healthy, which is why we're home doing baby things right now. Everybody's fantastic. I appreciate all the warm words that we've been getting, calls and emails from you guys, and it's super sweet. It warms the heart. It makes me feel happy. So I really do appreciate all the warm wishes that we've been getting from you guys. So thank you so much. And my family thanks you. And they love you more than I do, because they don't get to talk comp with you. They can just be happy. How do they calculate my average weekly wage if I've only worked at the company for 2 months? Great question. I love this question. I said it before in my nerdy workers' comp ways. Average weekly wage is one of my favorite things. The reason I'm late is because my hearing ran late, and I'm sitting there arguing average weekly wage with them, because they're going to try to chip away and undercut and show that you didn't earn that much each week. And I like to show that you earned a ton each week. And it sounds like it's dollars and cents. How could you push one way or the other? Well, you can. In this particular case, we were just arguing the insurance company's C-240. That's the form that they're required to file to show what your earnings have been for the year leading up to your accident. And this is going to get to your question in a second. But they're supposed to tell us what you earned in gross salary for the 1 year leading up to your accident, and then we average out those numbers. Well, this C-240, this form, this accounting of this person's earnings was not very clear. And they didn't really fill out the form. They just got a printout from the employer, sent it in, here you go. And I'm sorry, I don't read hieroglyphics, and it's not my job to interpret your paperwork if you're not going to do it properly. So I'm going to do the best I can to interpret it in my way. And there was some weeks in there that were marked as holiday. Well, when I see holiday, I think it's a week that a person didn't work and got paid for it. So I'm not going to let you tell me that gross amount that person earned for that year should be divided by 52 weeks. There's 52 weeks in a year. I'm not going to let you divide by 52 weeks if there's a holiday week in there. That's a week that person earned. That's a week that person got paid for. And that's a week that person did not work. So I'm not going to let you take credit for it as a work week. I'm going to divide by 51 weeks. And if he took 2 weeks of holiday, I'm going to divide by 50 weeks. And if he took 4 weeks of holiday, I'm going to divide by 48 weeks. And each time that number goes down, your average weekly wage goes up. And as your average weekly wage goes up, your benefits go up. So that's one of the ways that we like to address and interpret average weekly wage, and do it in a way that suits you best to get you the most amount of money. Now, what happens if you only work for the company for 2 months? Well, if you haven't worked a substantial portion of the year leading up to the accident, I'm regurgitating law to you, what they do is they ask for a similar worker's payroll. They ask for the payroll of a similar worker. And they give us somebody that has worked there in a similar job, similar capacity, that has worked there for a full year, and they give us that payroll. And they also should give us your 2-month payroll, because I like to compare. If you've only been there 2 months, and in that 2 months you were getting paid $1,200 a week, and the similar worker has been working there for 5 years, and in the last year the most he got was $1,100 a week, well, my argument is you're not so similar. You're getting paid more, and this is not a similar worker. So they are supposed to provide a similar worker payroll, so we can use that additional information to try to evaluate and figure out what your average weekly wage would be. I've had circumstances where we take that similar worker payroll, we throw it right back in their face, and we say, this is completely wrong. I'm going to take these 2 months, divide this gross total by 8 weeks, and that's going to give us a more accurate average weekly wage. So sometimes we can do something as simple as that, and sometimes we have to get more information, and sometimes we take that similar worker payroll and interpret it in a way that suits us best. I see everybody joining on IG. Thank you. TikTok. Thank you. I'm going to make one minor request today. If you have a question on Instagram and I don't get to it, I apologize. I promise I'll get to it in a future live, or if you shoot me an email on it or whatever, I'll get to it. My iPhone is clipped by a hair clip to my laptop, and if I dare breathe on it right now, it's going to wind up on the floor. So I don't want to touch it to try to scroll through questions. Hit me another time, and I promise you get first priority on question answering. Thank you for that. Disclaimer. Now, nostalgic. I can't read little writing like that. Nostalgic, is that art? What if you injured a body part in the past and you tell them, but you don't remember the exact year the injury happened? Happens all the time. You know, not everybody's so young anymore. And if you had a car accident in 1978, well, you might not remember if it was 78 or 79 or 80 or 72, or the year or the month and the day. People have bad memories. We get it. If you did, as always, get out in front of those past injuries, past disabilities, prior accidents. Make sure you disclose them to your doctor. Make sure you disclose them to their doctor. Make sure you tell your lawyer, the judge, if they ask. Put it on your claim form. You want to get all that information out, and you don't want to get blindsided by it. But if you truly don't remember the date that it occurred, that's fine. They're going to ask you a lot of questions about it. They're going to ask you, do you remember the doctors that you saw? Do you remember the hospital that you were taken to? Do you remember if you had a lawsuit? Do you remember who your lawyer was? They're going to ask you if there was a lawsuit involved. If there was a car accident, you got rear-ended, they're going to ask you to reach out to your lawyer to get information from your lawyer. They should have some information on when it happened and what body parts were affected. So do the best you can to come up with as much information as you can. Get out in front of it. You don't want to make it seem like you're hiding information, and let them know. If you don't remember the exact date, year, whatever, just be honest. Give them whatever information you can come up with, and they'll do their best to screw you with it, but you have to do it. And you're better off getting out in front of it and being upfront and honest than having them find out about it and blindsiding you. And I've said it before, I'll say it again. The insurance companies, I just draw a brain fart and I don't remember the name. ISO. The insurance companies have a database that they maintain. It's called the ISO reports are what they use. And they can and they can search 100 different ways. It's not just your name. It's not just your social security number. They can search by your date of birth. They can search by aliases. They can search 100 different ways. And any claim, any insurance, anything that's ever occurred that has any of those search terms attached to it, whether it's your name, date of birth, social security number, phone number, address, whatever, is going to pop up in this database. And they'll come back to court and they'll say, whoa, we did an ISO search and you had a car accident in 1996. And you're going to go, holy crap, I did. Or you're going to say, no, I didn't. We've seen cases where you had a car accident in 1996 and the person says, no, I didn't. And they go back and do some digging. Yeah, my son was driving my car and he had a car accident and the car's registered to my name. Boom, your name popped up. So they're going to find information on you, whether you like it or not. So that's why it's super important to get out in front of this stuff. Give them as much information as you can. Don't get blindsided because it looks terrible if you don't disclose it. Now, what if you've been diagnosed with PTSD from a work-related accident and you're currently mentally unable to return to work? PTSD, mental disabilities, anxiety, depressive disorder, mood disorder, there's a ton of them. They are compensable just like any other physical impairment. The law has changed over the years. There used to, way back in the day, there used to have to be a physical manifestation of your psychiatric or psychological disability in order for it to be compensable. What does that mean? Shingles, you get a rash. There's a lot. You need to have something physical to show. Why? Because it's easy to maybe fake a psychological disability. Not so much anymore. And the law has, again, recently changed. Governor Hochul has enacted some new changes to the law where psychological and psychiatric disabilities are compensable. Don't be afraid. I know people are afraid of the stigma attached to it. I've had clients tell me they want to withdraw the claim for psych. They don't want to pursue it. They don't want that stigma attached to them and their professional life. I get it. I understand it. Don't be afraid of it. Get the treatment you need. Get yourself better. Get back to work and put this whole mess behind you because that's what you got to do. And this is a way to get treatment for those unfortunate disabilities. And I really feel for people like that because there's some people out there that have, people who go through really bad accidents and injuries, and there's some horror shows out there. PTSD is a real thing, and I really feel for a lot of people, and it pisses me off when insurance companies try to bully them around, and I try to do what I can to make sure that you get what you need because you deserve it. Here's one so I answer a lot of these questions that you guys post in the comments for each video, and I really made myself laugh with the answer I gave on this, which is why it's here. How long do investigators usually do surveillance for? My answer is however long they get paid for. The investigator is not anybody other than a guy or girl doing their job. And they will sit there and do surveillance and sit in a car for hours on end and days on end and weeks on end. If the person could be in Taiwan for a month, and if they were directed to sit there and do surveillance for a month, they're going to sit there. They're going to sit there for as long as they're paid to sit there. Now, the investigator does go back to the insurance company and the person, the adjuster, whoever ordered that surveillance, and they give them updates and statuses and things of that nature, and they have recommendations. Hey, the guy seems to come home every day at 4 p.m., so maybe it's not worth it for us to sit there between 10 and 4. Let's do surveillance from 4 o'clock to 8 o'clock. That's when he seems to be most active, and they'll try to hone in on when they think they're going to get you. But they're going to do it for as long as they're told to do it, as long as they're directed to do it, as long as they recommend and their recommendations are accepted to do surveillance. So again, don't be doing things that are wrong. Don't be doing things that you shouldn't be doing, and you're fine. And you really should be able to perform the activities that you tell your doctor that you're able to perform, and your doctor recommends that you're able to perform. So there shouldn't be a problem to begin with. It's the people that are trying to fudge the lines and make something, and it's really never worth it. Be open, be honest. Don't try to screw around because they'll get you, and it's just not worth it. I want people to be safe, be open, be honest. Don't get nailed doing something you shouldn't be doing. So Heather's question, we get another question all the time. MSAs. If you have an MSA and it runs out, will Medicare pay for medical coverage for, do we continue this one? No. So how does an MSA work? You get hurt. You have all these injuries. You're going to go to settle. You're on Medicare. You're on Social Security disability. You need a Medicare set aside. A Medicare set aside is the amount of money Medicare tells you you need to set aside from your settlement to pay for your future causally related medical care, your treatment related to your accident and your injuries from the case that you are settling. And why does Medicare do that? They do it for two reasons. Reason number one, they want to know about you. They want to know about your accident. They want to know about your injuries. They want to know about the treatment that you've received, because they're going to go back and check their records to make sure that Dr. Smith never billed them for an MRI for your back that was related to this case. They want to make sure they've never paid a bill that they shouldn't have paid, that workers' comp should have paid and Medicare should not have paid. Medicare is the federal government, and if they can save money, they're going to save money, and they trump us all. They're federal. We are the workers' comp is state. So if Medicare paid a bill that they shouldn't have paid, that your workers' comp carrier should have paid, rest assured they're going to want their money back. So they want to go make sure their records are clear up to the date of your settlement. Next thing they want to do is they're going to make sure they don't get a bill in the future for something that they shouldn't be paying. Why should they have to pay for a bill because you decided to settle your case? If you're deciding to settle your case, that's fine. But now you have to take their recommendation of what your Medicare set aside should be and set that money aside for you to pay for your future medical care. Now, it gets a little tricky in terms of what if the money runs out? Why? You're 35 years old. You have a horrible accident. Medicare says you need to set aside $100,000 for your future medical care. What does that really mean, though? That $100,000 that they're telling you to set aside is the present dollar value of what you need to set aside for your life. So you might actually need to set aside $150,000, but $100,000 today is going to cover it, because if you put it in an interest-bearing checking account like they tell you to do, that money's going to grow a little. It's going to last over time. There's a lot of math here. They have an actuary, and it's all super nerdy math stuff to really get into it. But what happens if you actually take that money and you set it aside and you're paying your doctors like you should be, and they're not overcharging you, they're charging what they should be charging you, and you're following the rules? Medicare has a handbook that you're supposed to follow when it comes to administering your own Medicare. I tripped over administering your own Medicare set aside. If you follow their rules, you keep the records they tell you to keep, you put it in the account they tell you to put it in, you spend it the way they tell you to spend it, and you run out of money, well then yes, you can go back to Medicare and you say, hey, look, I did everything you told me to do. I set aside the money you told me to set aside. I put it in an interest-bearing checking account like you told me to. I made sure I got only treatment, authorized treatment. I didn't go to a witch doctor in Botswana to get bloodletting for $50,000. No, I'm getting chiropractic care, physical therapy, MRIs as requested. I'm doing things by the book, and I ran out of money. Well, then Medicare is going to review all of those medical records to make sure that everything was done correctly. They're going to make sure all the bills were paid, you were charged the right amount, you paid the right amount. And if they were wrong and they assessed your medical incorrectly, you can request that they kick in and help you. Will they do it? That's between you and them ultimately. I've never seen it in my practice, but that's how it works. Will receiving workers' compensation benefits impact my VA disability payments? Now, this is another group of questions we get all the time. This leaf is really getting to me right here. It keeps tapping me on the shoulder. People ask all the time, will this impact my Social Security benefits? Will this impact my VA benefits? Will this impact my, my pension? Will this and to be completely frank with you, each one of those different places that you're getting benefits from, you need to check with them. Sometimes yes, sometimes no. As far as Social Security, for instance, is concerned, if your workers' comp benefits and your Social Security benefits combined exceed a certain amount of money, Social Security gets offset to get to that threshold. Workers' comp does not. So as far as I'm concerned, as your workers' comp attorney, your workers' comp is going to remain untouched. Your Social Security might take a hit. I don't know how VA benefits work. I don't know how your pension plan is set up. I don't know how your private disability policy is set up. They're all different, and you need to check with them. As your attorney helping you, you get me the documentation. We can sit down, go over it, and I can try to steer you in the right direction. But those different places where money comes from, you got to check with those people. And we do get that question a lot. If I'm on workers' comp, will inheriting money from my parents affect my benefits? No. Another question that we see every once in a while. Passive income inheritances are not work, so it shouldn't have any impact on your workers' compensation case. Active income, passive income is a touchy subject, because if there was work involved to get that passive income and maintain it, then it could be deemed work, construed as work, that could have an impact on your benefits. But inheriting money should not have an impact. That's all for the slides. That's all for the slides. Let's see what you got for questions. Natalie. Hello, Rex. Hello, Natalie. My New York workers' comp, low back injury. Lawyer's trying to settle, and the doctor said I reached MMI, maximum medical improvement. Now I feel another side of injury, neck. Is it possible to close my case and get compensation for the neck? Great question. A lot of questions to follow this one. Are we talking about a new accident? Did you have a new accident, a new injury? If you had a new accident and you injured the neck in a new accident, file a new claim. That's as simple as that. If your neck was injured in the original accident where you injured your back, you got to now be careful. There's a 2-year statute of limitations. Did you ever raise that neck injury within the 2 years? Are you still within the 2 years? Has the 2 years passed? If the 2 years has passed and you haven't raised it, you might have lost it. If it's still within the 2 years, or if you already raised it, then you should go after it. You should talk to your lawyer. You say, hey, let's not settle so quick. We got a neck here and we didn't really talk about it. So maybe you need to do that. If the third circumstance, consequential injury. I'm not a doctor. I don't know how, I don't know why, I don't know what. But if your neck injury developed as a consequence of your back injury, which is from the original accident, then the 2 years doesn't necessarily apply. So you do have the potential of claiming a consequential neck injury if, in fact, that neck injury came sometime after and is a result of the back injury. We see that a lot of time with knees. If a person has a bad left knee because of an accident and they've been limping around for a while, and 2 years later, because of the limping, they have a bad right knee, consequential right knee. If they're limping around on a bad left knee and their back starts hurting and they have a back problem, consequential back injury. Vice versa, we see with backs and knees, ankle and ankle. Shoulders, arms. If your arm's been in a sling because you had a really bad injury and you had surgery and you've been in a sling for the last bunch of months and you're only using one arm, and that arm has now developed some sort of an issue, cubital tunnel syndrome, a torn some potential consequential claim. Fantastic question. So much so that I'm giving you the first gold star of the day. I wish I could take a water break. I didn't bring a bottle of water here with me, so I'm not even going to talk about the Mets right now. I was going to throw an obligatory let's go Mets up there, but man, I went to bed last night. They were up 6-0. I didn't even 6-0 against the Braves. We're good. We weren't so good. Such is life. There's bigger and better things to focus on, and I think we'll be okay for the playoffs. Mrs. B, I miss you too. Okay, let's move it on down the line. QB, I'm so confused. Insurance company denied PT injections. What am I supposed to do? Talk to your doctor. Here in New York State, medical treatment is administered by the board through the PAR system, the portal. When you first get hurt, your doctor's supposed to follow the medical treatment guidelines. They say if you have a low back injury, you're entitled to 12 visits of physical therapy. I'm making up numbers here. I'm making up scenarios. I'm just telling you as an example. But they follow the guidelines. If additional physical therapy is being requested, they have to put in a request through the PAR system. They have to wait for that request to be addressed by the carrier, approved or denied. And then there's levels. If it's denied, you can go to the next level and so on and so forth. You could eventually, if the denial persists, you can ask the board's medical director to address the denial and the request. You could potentially request a hearing and have depositions on the matter. But this is a medical question. This is a doctor question. This is a doctor, what do I do? And if your doctor is not sure, tell your doctor to call your lawyer. Let everybody get on the same page and figure this out so you can get the treatment that you need. So many times I get a client that comes in that says, the doctor told me to come see you. Why? My PT was denied. What do I do? You go back and talk to the doctor. Either he doesn't know what he's doing or he's being lazy. We can't put requests in through the system as lawyers. We can only track them and address them at certain points in time. It's really on the doctor to take care of. John Carney, when they suspend your pay from workers' comp but no attachment to the job labor, the judge gave me time to do searches. I have a hearing after 60 months. Should I receive all that back pay? Potentially, yes. So if let's just make a scenario here. On November 1st of 2024, the judge says, do a work search. And we're coming back to court on January 1st. 2 months later, you come back on January 1st, and the judge says you didn't do a good enough work search or whatever, and he suspends your benefits. Well, now you're still required to do that work search. If you walk, well, we don't walk out of court anymore. If you get off that hearing, and you finish that hearing, and you start pounding the pavement, and you start doing a work search, and we're going to talk work search next week. I have a monster work search video coming your way. So we're really going to get into it next week. But you start looking for jobs. You go to Workforce One. You do everything you're supposed to do. And that starting January 2nd, you do all that. And your next hearing is May 15th. You go back on May 15th. If you could prove that you've been doing work search and you've been breaking your butt since January 2nd, you have a very strong argument to get your benefits picked up from that date that your work search really kicked into high gear and forward. So to answer your question, John Carney, yes. QB is 52. I'm 46. Next. One Deep Under God. Hello, Rex. I've been on workman's comp. We don't use workman's comp anymore, by the way. I'm smiling. It's okay. You can use workman's comp. I've been on workers' comp for a year. I found from HR that I was included in a layoff that they had back in April. So the layoff came after you got hurt. If my doctor releases me to go back to work tomorrow, what will happen? It sounds like they're going to lay you off. If they're laying you off for unrelated reasons, you have a tough argument. The only time you really have a strong argument for within the workers' comp world, if they're discriminating against you for filing for or participating in testifying in somebody else's case, for having a workers' comp case. If they fire you for that and there's proof of that and you can show it, then you have a workers' comp discrimination action that can be brought. If they're firing you because of your race, religion, color, age, sex, sexual orientation, all those things, then you go outside the workers' comp world and you file a discrimination action. If anybody ever needs help with that, we have some fantastic attorneys that handle those cases and have gotten some really good results for our clients, because it happens and it shouldn't. It's so stupid when people are so short-sighted and if you feel like that's happening, you let me know, because I love slamming people who do that. Frederick Simmons has been on workers' comp since December of 22. They finally gave me my percentage, which was 17%. They have been paying me weekly so far. Now they say I'm about to transition to SIB monthly. I don't know where. Are you in New York, Frederick Simmons? Tell me what SIB means. Robin, thank you. It's great. It's fantastic. I give all the credit in the world to my lovely lady. She does all the work. She did all the work. She did a miracle. I was but a passenger on that ride, and she did an amazing job. She continues to do an amazing job, and it's very awesome. And now we have 2 wonderful children. So life is good around here. Frederick, I knew it. You're in Texas. See, before I knew you weren't in New York. Will they just pay me a lump instead? I don't know. I don't know Texas law. I know Texas is a great place. I don't know the law there. If you need help finding somebody, you can give me a call. I can help track somebody down for you. If you don't have a lawyer, if you have a lawyer, call your lawyer and just say, bro, it's been December 22. Give me some answers. General hobbyist does it all. He does not have a specific hobby he enjoys. Could be model trains, could be model airplanes. But he's about to go to 2 defense IME appointments. How will the judge value their opinion over your doctors? To be completely honest, every judge is different. Every judge takes it differently, reviews it different. Every IME is different. Every treating doctor's report is different. So each case is its own, I always say, it's its own little creature. Do some judges give a little more deference to the treating doctor because he's the treating doctor? He's seen you 52 times over the last 2 years. He has a better understanding of what your condition is than the guy that's seen you twice for 10 minutes at a time. I certainly make that argument. Do some judges give the IME a little more deference? He's He has no stake in the game. He's not making a dollar off whether or not you treat or not. He has a more independent, objective view of your case. Yeah, some judges feel that way. It's hard to say. That's why you go in there, you give them your all, you give your best effort, and you deal with that report when it comes out. You can't really do anything beforehand, and if you try and they think you're malingering or doing something to skew the results of that IME, you're going to get steamrolled with it. So the general hobbies is helping Frederick out. Did he not issue a scheduling order? SIB is supplemental income benefits. Either way, I don't know Texas law, so I don't know. That's a great question for your lawyer. Call him up. Devon, I had surgery on my low back, L5S1. I had low back surgery, L5S1, with a Barricaid device. I didn't have a Barricaid device. I don't know what that is. I've been experiencing nerve pain before the surgery, but it has increased. Will this be considered non-schedule and schedule case? In New York State, a back injury is a non-schedule case, and it's handled like any other non-schedule case. Cases don't go from non-schedule to schedule. They can go from schedule to non-schedule. If you have an 80% SLU of both arms, that could be converted to a non-schedule type of case, but cases don't go back the other way. Do I only answer paid questions? I answered your question, and I answer every question that comes up here. Or are you asking about the IME? They answer paid questions, not me. Ms. B is going to get on you. Grrr. What do we got here? Mike. I had 2 surgeries in 5 weeks. Infusion, laminectomy, there it is, my biggest fear. Laminectomy, got infected. I had 6-week home IV antibiotics. I had to have the original hardware taken out in 10 months. How can I settle before that? I'm over it mentally. And there it is. You just summed it up. We get a lot of clients that say, I want to settle my case. I need surgery. I need shoulder surgery, but I'm not doing it for another 5 years. Settle my case, get me the money for my shoulder surgery, and let me just move on with my life. And that's the reason why I'm so afraid. And I again, I'm not a doctor, but I see stuff like that happen, and I want to make sure you're aware of it so you could be warned and you could be cautious and you could just prepare yourself, because you can go for surgery and you can catch a nasty infection. And those nasty infections aren't the type of thing where you go get amoxicillin from the pharmacy and in a week you're all better. Some of those nasty infections stay for years, and they're bad, and they can F you up really bad, and they can result in amputations, and they're really, really horrible. So if there's surgery involved, I always want to make sure you get through those big medical procedures and surgeries before we really start looking at settlement. Generally, again, every case is different, every circumstance is different, but you don't want to be like Mike, poor Mike, who had to have hardware taken out. Hardware presumably could stay in there for the rest of your life, and in 10 months, less than a year, they're taking hardware out. You're sitting home on IV antibiotics. It's a nightmare. And this sounds like one of the easier issues with post-surgical infection that I've seen. I've seen some horrible, horrible things, and you don't want to be caught up in that. So I understand mentally you're over it and you want to just be done with this. Talk to your doctors first. Make sure you're in the clear, mostly in the clear with your infection, mostly in the clear with your future treatment, and maybe it's time to discuss settlement. Talk to your doctor first, then talk to your lawyer. Trent, you didn't finally catch me. I finally caught you, but thanks for joining. I got my last check from workers' comp in early April. Do I get back pay from April? Not out of my settlement. I reached MMI 3 days a week, 4 hours a day physical therapy. I had hit my head on a forklift. So you have a head injury. You got your last check from workers' comp in early April. I would need to know a little more about your case. Was there a labor market attachment issue? Why was your last check in April and you didn't see anything since April? I would need to know why that's happening. Not just any Steph, but the Steph is saying, if you're enjoying the live stream, hit the like button, subscribe. Again, I'm sorry I missed you guys for the last 2 weeks. Had a lot going on around here, but we're back. We're scheduling another live, I believe, for next Wednesday, 4 o'clock, 4:30, something like that. Labor market attachment. I want to make sure we nail that one. We've discussed it before. We're probably going to do another live in 6 months on it, because that's the biggie. That one keeps coming back and coming back and coming back. I know we love talking about settling and how to get the most money for our case and how to, walk through the daisies and move on with our life. But labor market attachment is that big hurdle that you got to overcome to get to that, to get to the daisy field, folks. So don't forget to like, don't forget to subscribe. Please join us next week when we talk about labor market attachment. Keith Jones is from California. He's waiting on a letter from the ALS doctor to agree with the PTP that chemicals from my job cause my ALS. How long should that letter take? I don't know California. ALS, man, I'm sorry. That's terrible. I feel for you, Keith. I have some close friends and people that I know who've dealt with ALS, and I'm so sorry to hear that, and I really feel for you. I hope you have a lawyer. Call your lawyer. If you, man, anything you need, you call your lawyer. Hey, bro, what's the status on this letter? How long should I be waiting for it? Get back to me. I want to know. You got a lot to deal with, and finding out the status of a letter that could mean a lot to you is not something you should be worrying about too much. It should be on its way. So call your lawyer and ask him for that. I wish you absolutely the best. I hope I wish only great things for you, Keith. Crazy Dude. Let's see if we wish Crazy Dude good things. He got wrist. Jesus, man, you guys are breaking my heart today. Wrist fusion surgery for the pain to go away. What happens if the surgery helped, but some pain is still there? Does that increase the permanent disability rating? So here in New York State, a wrist injury, schedulable site of injury. How do they evaluate schedule loss of use of a wrist? Let's move that down so you can see my wrist better. The basic way of evaluating schedule loss of use for any of those scheduled body parts, arms, legs, hands, feet, fingers, toes, is range of motion testing. There are special considerations, and you can go into the Workers' Comp Board website. You could look at the guidelines on how they determine schedule loss, and you can see what the special considerations are. Wrist fusion might be one of them. So if there's a special consideration like wrist fusion, frozen shoulder I know is one of them. Total knee replacement. Total knee replacement starts at 35% loss of use. I don't know if for a fused wrist, it probably is one. I don't know exactly what it is, but it's range of motion. How does pain play a factor in that? Well, you have no motion if you have a fused wrist. You cannot bend it unless you have some sort of fusion that allows you some motion. If the pain limits motion, then it might be a factor. Also, if it is a special consideration, pain and other factors could increase the value of that schedule. So make sure your doctor knows. But what I recommend that you do before anything, when we're done here, because I know you're going to watch the whole video, you would never dare leave me early. What I want you to do when we're done, just Google New York State Workers' Compensation Board. Scroll down a third of the way on the page. There's a healthcare provider section, or you could probably Google New York State Workers' Compensation Board medical treatment guidelines for determining permanent impairment. Just go to the medical section, and you'll see it. Click on that. There'll be a tab for guidelines for determining impairment. You click on that one. Click on the guideline. Go to the section on wrist. It's page, I don't know, 27, I think, and it'll walk you through how a doctor is going to evaluate a wrist injury. And then at the bottom of that will be special considerations. If wrist fusion, I don't want to click out of this because I'm on my laptop, folks. And normally if I was in the office, I would do it for you because I have multiple screens going. I cannot really do it here. So I'm sorry. But if you find it's there, and if not, hit me up next week on our live next week, and I'll go through it with you. Blue collar. I love PBRs, and I love blue collar POV. I got laid off during my workers' comp. I'm released to work usual and customary duties, but still getting workers' comp payments. Will workers' comp reach out to a new employer for any reason? You're saying, will workers' comp advise a new lawyer that you have an old injury? Not in New York. I've never seen it happen, but you shouldn't be worried. You are who you are. You're a guy with an injury right now. They cannot necessarily discriminate against you because you have an injury or a disability, but if that prohibits you from doing the job fully, then what am I looking at, Keith? If you can't do the job, then maybe they're not going to hire you. So I understand your concern there, but I have never seen workers' comp inform an employer, a potential employer, of an old injury. Keith, what's up? I got your question. How long is it going to take to get that letter? That's you got to call your lawyer for that one, right, Keith? Obsidian Exchange. What happens if you refuse all surgeries? Does workers' comp look negatively towards that? Not really in New York. Surgery is optional. Unless you're in a coma and you're bleeding out and they have to do surgery to save your life. If your doctor says, hey, man, we want to do a knee scope, and you say, look, I'm deathly afraid of surgeries, I don't want to go through surgery, you don't have to have surgery. Some people don't do surgery for religious reasons. So it is what it is. If that's the end of the line, if the last possible treatment that you could get would be surgery and you don't want to do surgery, then you're probably at MMI, and they're going to evaluate you for your permanent disability, and you're going to move on. Miss B wants to have a baby shower. You want to do a virtual baby shower? I'm not that guy. We don't do gender reveals. I'm old school. Make a baby, have a baby, take care of your baby. That's me. General hobbyist. We're on TikTok, Instagram, YouTube. Keith, if I missed your question, yes. Miss B says repost that question. Any experience in right wrist fusion cases? If so, what determines the disability rating and what should I expect to be a good rating? A schedule, right wrist fusion is you're at zero range of motion potentially. So you're looking at a very, very high schedule, if not 100% loss of use of the wrist, potentially. But that could be so significant to get you into the non-schedule category. Do you have a lawyer? That's a question for your lawyer. Do you have other injuries from that case? That could put you over the limit and put you into the non-schedule category. Have I seen wrist fusion cases? Absolutely. Do you have RSD, complex regional pain syndrome? The few wrist fusion cases I had were significant. The injuries were severe enough to the point that the person developed RSD, which is a horrible thing. And I hope you don't have it, but it is something to be on the lookout for. And again, I'm not a doctor. I'm not giving medical advice, but I have seen that. One Deep Under God gave me a 2-part question, but I only see part 2 here. So where's part 1? Repost part 1. I don't see part 1. Wow, a lot of questions just came in. I got a few minutes left here. I'm going to get to who I can. Devon or Devon. Laminectomy, discectomy, foraminotomy with endoscopic assist, implantation of... You didn't necessarily make a mistake. Surgeries are here to help you. A lot of people, and again, I'm not giving medical advice, and I'm a guy who's had surgery. I'm a guy who sees people who have surgery. This is what I always tell people. Like if you have a car and you get into a car accident and they fix it, but it's never really the same. That's like your back. When you hurt your back, they could fix it, but it's never really the same. And I know that from experience because I've been through back surgery and epidural injections and you name it. I've been through every back treatment you could imagine. It's never really the same. Once you hurt your back, you're a guy with a bad back or a girl with a bad back. Once you hurt your back, it's never really the same. They can fix it. They can make you better. They can improve your disability. They can improve your functioning. They can get you from here to here, but they're never going to get you back to 100% because you're a guy with a bad back now or a girl with a bad back. So, sometimes people say, I had surgery. I'm still in a ton of pain. Well, you're probably in less pain than you would be if you didn't have the surgery. I'm in a ton of pain. I had surgery and I can't play basketball like I used to. Well, you probably weren't going to play basketball if you didn't have the surgery. So the surgery probably helped you at least a little bit. That's one way to look at it. Some people think surgery is going to make you all better, 100% back to normal. It's great when it happens, but sometimes it doesn't happen. That's my take on backs and surgeries. Mile High Travel Guy. D from California had less than favorable QME. QME is the IME of the California world. My lawyer requested a replacement panel. Problem is QME has since retired. When defense received requests, they in turn requested an MSC. What to do? Now we're getting into acronyms that I don't know. What to do? You have a lawyer? That's a question for your lawyer. Lawyer, what are we going to do here? Help me explain. Robin is looking at a C5-6, base of the neck, anterior cervical discectomy fusion. My indemnity was done. My medical is still open. Talk to your doctor. Get the pros, the cons. How much relief should I expect? What is the post-operative course of treatment looking like? Ask all those questions. asking questions, I'm surprised at how many people don't ask questions when somebody's going to go into your body and do something. But again, surgery is there to help. Miss B is here to help when she says, don't forget to like and subscribe. Thank you, Miss B. Thank you, Miss B, for being there for me. Gold star for you. Where? Oh, I already answered part one? Okay, awesome. So where's part two? Let me get to part two. Part two, how does the layoff affect my settlement and my overall case? If my doctor releases me to light duty, then what happens? Do I still receive my weekly payment from WSI, or will they be discontinued? You're not a New York guy if you're saying WSI. But here in New York State, if you go back in light duty, you're entitled to reduced earnings benefits. If your earning capacity was impaired because of your injuries, you could potentially apply for more benefits for reduced earnings. So your state might have something similar. Talk to your abogado and see what he's got to say. Agent 7 is in a similar boat. I had 2 herniated discs in my neck, 1 in my low back. I'm on light duty at reduced earnings. Ka-ching. And the insurance company told me they're cutting my benefits. Can I resign? Live in New Jersey. Is your case in New Jersey or is your case in New York? Can you resign? You're supposed to work to the extent of your work capacity. So resigning might make this worse, but you should absolutely talk to your lawyer about what's going on and what you could do to prepare and deal with it the best way possible. Is it a New York case or New Jersey case? Hard to understand. Dexter, I'm going to put it your second part first because he's in New York. I'm assuming it's a New York case. I had ACL surgery, out for 9 months. I'm at 50% now, having another MRI. What's next? Well, if your surgery was 9 months ago and you're not anticipating another surgery, you probably have 3 months left to start considering what your scheduled loss of your knee is going to be. Talk to your lawyer. You should have a lawyer. And if you don't and you need help and you have more questions, you could call me, 212-406-8989. But you're probably in the home stretch if there's no big treatment on the horizon. Ms. B is saying there's 47 of you in here and only 5 likes. Come on, people. Come on. It's just one click away. He's right. Just one click away. Unless your injury involves your dominant mouse finger, you should have like 46 likes here, people. You guys are funny. I've got a lot going on my back, multiple things wrong with my back. That could be a reason for SSDI. Absolutely. If you've been out of work for 6 months because of your injury and you anticipate being out a full year, call a Social Security attorney. Ask your comp attorney to send you to a Social Security attorney. If you don't know where to go, call me and I'll send you to a Social Security attorney. This is one of the times where what state you're in doesn't matter because Social Security is federal, and you could hire a New York Social Security disability attorney to handle your case in California or Wyoming or Vermont. And if you need help finding one, you can call me, and we work with some great attorneys. I've sent family to them, and they've done great jobs for everybody. So if you need help with Social Security, you can always call me. If you need help with a personal injury case, listen, and I hear all the time where clients call me up and they go, Rex, I know that you don't necessarily do personal injury, car accidents, ladder, scaffolding, trip and fall, construction accidents, which, we do what we have to do with those. But they say, I'm not calling a guy off a billboard, and I'm not calling a guy off the radio, and I'm not calling a guy because, I saw his ad on the back of a bus that he got Joe Schmo $20 million. Some people are turned off by that. And if you need help with that, you can call me. We have some I would trust these people with the new entry to my life. Some great attorneys. So if you need help with any of that stuff, anything you need, call me. We can always do what we can to get you set up and helped. Keith Jones, thank you for answering my question. The ALS doctor wants me to talk to my lawyer. Don't know why. Talk to your lawyer. Your lawyer is there for you to talk to. I play checkers with very few of my clients. We talk most of the time. Talk to your lawyer. Get an understanding of what's going on with your case. Adriana R. My husband got into an accident at work. He got burned and need 2 skin graft surgeries. Will he get a settlement? He could, potentially. Where did he get burned? Skin grafts. What was the donor site? Usually if you burn your arms, they take a donor piece of skin from your leg and they put it on your arm to graft the skin. And that donor site becomes a consequential injury, like we talked about in the first few minutes of this live. Consequential injury. So skin grafts, they take skin off a non-injured body part and they move it to the injured body part. Your non-injured donor site becomes, there it is, a consequential injury. Burned his face and both arms. What was the donor site? I'm betting his legs. Robin, CRPS, complex regional pain syndrome. Like we said before, throughout my body, started my right foot, severe ankle sprain, hit my back on the stairs. Patient's caregivers saw me fall down the stairs September of 21. Complex regional pain syndrome is a horrible thing, also known as RSD, reflex sympathetic dystrophy. Make sure your doctor and you are on the same page with that, and talk to your lawyer about what to expect in terms of settlement. And we're all here for you, Keith. All right, we're going to go a couple more here. And Ms. B wants to know, what's the name of the form that gives you the breakdown on what body part is potentially worth? Also, does it list non-scheduled injury body parts? No. So it's not a name of a form. If you go to that guideline that I was talking about earlier, it's the back page of that guideline. If you just Google New York State Workers' Compensation schedule loss of use chart, it should pop up. It's a chart, it's a grid, it has the body parts listed on the left side. The next column says HP, which is healing period, and then it gives you the percentages. Or I could tell you, what body part are you talking about? An arm is worth 312 weeks of compensation. So total loss of use, 100% SLU of an arm, 312 weeks. So at 10% is 31.2 weeks. A leg is 288. A hand is 244. A foot is 205. A thumb is 75. I believe this is 46, 30, 25, 15. I don't remember the fingers and the toes off the top of my head, but I know an arm is 312, a leg is 288, a hand is 244, a foot is 205. Non-schedules don't work that way. Non-schedule permanent partial disabilities, it goes by your impairment. So a 50% permanent partial disability gets you 300 weeks of benefits, and then up and down from there. Shabos, my attorney told me there's no settlement for your personal injury case in Texas. Is that true? I don't know. I don't know Texas law. Ask her for an explanation. Jeff, the doctor recommended 4 injections, facet joint and microdiscectomy for 4 disc herniations. I have 21. How much is my case worth? I need to know your salary. I need to know your lost time. I need to know, there's a lot of factors there, Jeff. If you want to go over it, you want to give me a call, 212-406-8989. This fine person, I'm SSI now, but workers' comp still in litigation. Could that case affect my SSI? Potentially it could. If you should talk to your Social Security attorney and your workers' comp attorney, and make sure that they both know that the other one's in existence, because there could be some impact there. Mrs. B is on it. 14 legs. So we had like 5 legs with 46 people. I guess 12 people, I answered their question, they ran away. But thank you. Thank you for monitoring. And thank you, 34, for staying. The hair clip is covering the amount of people that are here, so I can't even see how many people are left. I was laid off while on work. One deep. I was laid off while on workers' comp. If my doctor releases me to light duty tomorrow, will I still receive weekly payments? How does me being laid off while being hurt affect my case, my settlement? So if you're laid off, insurance companies will sometimes claim unrelated lost time. If you're disabled and they lay you off while you're disabled, that argument loses a lot of steam. If the doctor releases you to return to light duty and you're laid off, they have a little bit of an argument to be made there. But if your doctor's releasing you light duty and there's no job for you there, you could find something different. But you're looking at reduced earnings at that point in time. Nana, I'm gonna. All right, we only have a couple left here. My attorney and paralegal not responding. I had a status conference on 7/28. I got the minutes of the hearing that just shows settlement pending. My attorney and paralegal haven't responded. Keep calling them until they respond. Make an appointment in their office. Get it. You're entitled to that. I mean, 7/28 is 2 weeks ago, so there might not be much new information there, but follow up with them and get an answer. They should respond. It might just be, the 2 weeks lull. You should be getting something soon. Today's the 14th. You're a day off. QB, I have several herniated discs and disc bulges on the thecal sac. As a result, I have bladder issues. Is this a consequential injury? Potentially, yes. Usually when you see bladder issues as a result of lumbar pathology. It's a symptom of the lumbar pathology. Bowel, bladder, and sexual dysfunction are questions that are asked of the doctors when a person has a low back injury. So it could be just a symptom of the low back. It's kind of like if you have a low back injury and the pain shoots down your leg, doesn't mean you have a leg injury. It means you have symptoms from your back. So it could be that. Talk to your doctor. Ask if there's a specific diagnosis to your bladder as a result of what's going on with your low back. Shabos, torn medial meniscus in Texas on 1/26/24, which I had surgery on as well as PT for 16 weeks. I was out of work for 7 months, reached MMI with an impairment rating of 4 with no settlement. I don't know what the 4 stands for because every case is different. Every state is different. I don't know Texas law. Here's what it is. If you don't understand what's going on or you don't understand why things are working out the way they are, talk to your lawyer. Say, listen, dude, I feel like something's wrong here. Explain to me. Tell me, teach me what's going on. Make me understand. You're entitled to that. How about if I answer your question you like? That's a good trade-off. Oh, my darling just joined. Hello. Jeff Martinez, and I'm sure my daughter's watching as well. Hi, baby. Jeff Martinez has radiculopathy, cervical and lumbar. Doctor recommend. Let me go to Jeff's question. So we're looking at that, not Miss B. I do appreciate Miss B. I have radiculopathy, cervical and lumbar. The doctor recommended microdiscectomy and 4 injection facet. I have 400. Yeah, I know. Your average weekly wage was $900 a week. Okay, so your max rate in New York is going to be $600 a week. I've been 10 months on workers' comp. So the real question in terms of trying to figure out the value of your case, I know you said you were 21 years old before, so you're super young. Now you need to figure out what your permanent disability level is going to be. And insurance is going to take advantage of the fact that you're 21. They're going to say, you could get better, you can go back to work, you can put this all behind you. And your attorney should be saying, no, this guy's 21. He's going to be hurt for a long, long, long time, and it's going to cost you a lot of money. But we really need to figure out what your permanent disability is going to be to start really figuring out what your case is worth. Also, who's the insurance company? There's a lot of other little factors. It's hard to really just say, poof, this is a number. I like, if somebody's throwing a quick number at you, then it's no good. You want somebody who's going to look at your file, get an understanding of you and your case and what's going on so they can actually give you a fair assessment. Checking in with Ms. B, 39 in the chat, 17 likes. We're doing it, folks. Keep going. Now we're at 24 with 42 in the chat. People joined. People are liking. Vote for Rex. I love this. You guys are hilarious. Hi, daughter. You guys are so funny. Ms. B, thank you. Okay. QB, last question. And then I think I'm making dinner tonight. I met someone in the doctor's office who suggested I subscribe to your channel, and I will be binge watching. Thank you for doing that. And Catherine just joined. Catherine, QB met someone in the doctor's office who suggested I subscribe to your channel. You know, I'm always leery of people who get information from somebody sitting in the waiting room of the doctor's office, except for you and that guy. He did it. Folks, thank you so much. You guys are the best. Great questions. I'm sorry I missed you for 2 weeks, but I appreciate all the well wishes and the you guys are great. So what's the head and the neck worth? Head and the neck are treated like a back. So they're not schedulable sites. So there's no specific number of weeks because they're non-schedulable sites. Ms. B. Anyway, Ms. B's been great today. She's like the P. Diddy to my Biggie. That's a horrible, horrible thing. I'm sorry. I'm not trying to compare you to P. Diddy. I was thinking old school for a minute, and you're better than that. You're better than P. Diddy. Anyway, I'm an idiot. Thank you so much, everybody. Next week, Wednesday, I believe it's Wednesday, 4:30. We're going to post it, let you guys know when it is. Labor market attachment. We're hitting you hard with labor market attachment. Everything you want to know about labor market attachment. I'm going to make a little checklist. Work, search, and live stream next Wednesday, 4:30. Thanks, Steph. We're going to, that video, Steph knows this. I want to take that video. We're going to hang it on the website so that every time someone says labor market attachment, I'm going to explain to them what they need to do. I'm going to say, go watch this video. And then when you're done watching that video, you watch it again. And then again and again and again, and you take notes. That's your homework when it comes down to labor market attachment, because people are missing the big picture on labor market attachment, and I want everyone to understand, because I don't want you to lose your benefits. And that's really what it comes down to. Thank you so much. Great questions. Great live today. Miss B's got me. I love you guys. Thank you so much. We'll see you next week. Have a wonderful rest of your week and a wonderful weekend. Bye-bye.